Iodine is in seawater, and it's found in anything basically that lives in the ocean. It's got a ton of therapeutic actions. In the ER, what do they use to clean the skin? Iodine. You know that now they're starting to use bromine. Bummer. Yeah, bummer. So, biofilms are ways that pathogens protect themselves when they live in your body. So, yeast, for instance, lives in a biofilm. This is why someone would have a chronic yeast infection and they would take an antibiotic. The antibiotic would clear it up, but it comes back because those bacteria, the yeast, whatever it is that's in there, is living in a biofilm. The biofilms protect them from the immune system, protect them from an antibiotic. It's basically a safe house. So iodine helps to break those biofilms down so that the immune system can get at whatever pathogen might be coming along. So the Japanese intake of iodine is 13.8 milligrams per day. They eat seaweed like we breathe. They eat so much seaweed. So they have a very low rate of breast and other cancers if their diet is traditional. Our amount of iodine is decreasing because we don't eat a lot of fish. And I'm not saying we as in we, but I'm saying we as in the whole, right, in America. Our fish consumption is going down. The NHANES study showed that iodine levels decreased 50% from 1971 to 2000. So in 30 years, basically, our iodine consumption dropped by 50%. Can you have a healthy thyroid without having adequate iodine? It's impossible. You can't do it. So the body needs a minimum of 13 grams per day. Interesting. Milligrams, sorry. Look how much the Japanese person eats. Isn't that interesting? Their traditional diet is what the body needs. I love that. I love that. So 13 milligrams per day, 20% of all of the iodine that we consume is actually stored in the thyroid. Yay, thank you. Breast and ovarian tissue are next in their concentration of iodine. Did you know that the breast tissue, we've talked about that this morning, but did you know that the ovaries actually can manufacture thyroid hormone? They're the only other tissue that can manufacture thyroid hormone. And we'll talk about that in a bit. But all the rest of the iodine goes in every other body tissue. So what happens is the ovaries collect iodine and they synthesize T2. T2. What two hormones does the thyroid make? T3 and T4. Which one does it make the most of? T4, very little bit, 5% or less of T3. What the heck is T2? Think about the construction of a thyroid hormone. T4 contains 4, and when we make them, think back to the picture, what's it made of? 2 2s, right? 2 2s is 4, and a 2 and a 1 is a 3. So what's T2? It's just 1, 2. How's that for who's on first? So white blood cells also can produce thyroid hormone. Isn't that amazing? Skin stores about 20%. This is what I was talking about earlier about the inability to sweat. Muscles store 32%. So if you have muscle pain, it can be iodine deficiency. Like fibromyalgia, generalized muscle aching could be, I'm not saying it always is, but it could be an iodine deficiency. 72% of the world's population is affected by iodine deficiency. 72%. They did a study with about 5,000 patients, and they found that almost 100% of them, 96%, had low iodine levels versus what we call a serum spot test or a 24-hour collection. Almost all of them, 96.4. Current estimations are that 16% of all men have low levels and 17% of women are extremely low, like really low.